Hi everyone. Today I'll be taking another Viva Live session with QQSphere on the topic of anatomy. And under anatomy, I'll choose neuroanatomy. As a subtopic, I'm choosing internal capsule. Let's start.
Welcome to the neuroanatomy examination. Today we will focus on the internal capsule. To start, can you describe the primary function of the internal capsule?
Yes, uh, the primary function of the internal capsule is to relay information via
You're on the right track. Could you specify which types of information, like specific pathways, pass through the internal capsule?
Yes, there are two pathways, ascending and descending tracts, that are densely packed here. It is a compact V-shaped mass of projection fibers situated between the caudate nucleus and the thalamus, and the lentiform nucleus laterally.
Excellent description of the location and fibers. Now, could you tell me about the main parts of the internal capsule, perhaps focusing on the blood supply to these parts?
Um, its parts are anterior limb, genu, posterior limb, retrolentiform part, and sublentiform part. The anterior limb lies between head of caudate and lentiform nucleus and contains frontopontine fibers and anterior thalamic radiations. The genu contains corticonuclear fibers. The posterior limb lies between thalamus and lentiform nucleus and contains corticospinal fibers, superior thalamic radiations, and somatotopically arranged motor fibers.
That's a very comprehensive breakdown. Now, focusing on the blood supply, which arteries primarily supply the posterior limb and the genu?
The blood supply is mainly by small central perforating arteries. The anterior limb is supplied chiefly by medial striate artery of ACA and lateral striate arteries of MCA. Anterior cerebral artery and medial cerebral artery.
Yes, that's correct for the anterior limb. What about the posterior limb and the genu? Which arteries are responsible for those?
The genu and most of posterior limb are supplied by lateral striate branches of MCA, medial cerebral artery. Uh, these are Charcot arteries of cerebral hemorrhage. Yes.
Precisely, the lateral striate branches of the middle cerebral artery, often called the arteries of cerebral hemorrhage. Now, thinking about a clinical context, what would be the typical presentation of a lesion affecting the posterior limb of the internal capsule?
In a lesion, especially hypertensive hemorrhage or lacunar infarct of lateral striate vessels, it causes contralateral spastic hemiplegia from corticospinal interruption, often with upper motor neuron facial weakness, hyperreflexia, Babinski sign, and contralateral hemisensory loss if thalamocortical fibers are involved.
That's a thorough explanation of the motor and sensory effects. You mentioned Babinski sign. Can you briefly explain how you would elicit this sign and what a positive response looks like?
To elicit the Babinski sign, uh, the we will
Take your time. How would you stimulate the foot and what's the normal and abnormal reaction?
uh, to elicit the Babinski sign, uh, we will firmly stroke the lateral part of the sole of the foot from the heel upward toward the little toe, then curve medially across the ball of the foot. A positive sign, which is abnormal in adults, is indicated by dorsiflexion of the big toe and fanning of the other toes. but it is normal in pediatric ages, in infants. Hello.
Are there any other key vascular syndromes you can recall related